Assalamu alaikum wa rahmatullahi wa barakatuh. Very good evening. Welcome to another edition of Health Matters. A little bit later, as we know, load shedding is the norm of the day, and that's what's happening here. But the show must go on. Alhamdulillah. Shukran to the facilities and our technical team on the other side who makes it happen and runs crazy around to actually make it happen, to bring the show to you. Today we focus on Pregnancy Awareness Week, and we took to the streets and asked some individuals their opinions around pregnant women. Another highlight for this evening to stay tuned to, and remember, we want your interaction, we want you to participate in today's show, is the HPV vaccine. What is that? Human papilla whatever vaccine. We're going to tell you a little bit later on. I didn't get that, and you're going to be stuck with it as well, but we're going to clear all of that. HPV vaccine, more on the show. Please interact with us. We've got a WhatsApp line up and running, so please take down that number, and then also our live in studio number. But before we continue, let's hear what a few of our viewers had to say on the streets, the Pregnancy Awareness Week. Take a listen.
What I would say is be healthy, eat well, and don't eat for two. Do not eat for two, because that child is being sustained by you. So if you sustain that child healthily and you are always in a happy state of mind, that child already know emotionally he is going to be strong or she is going to be strong. If you are going to be erratic, if you're going to be dysfunctional, if you're going to be angry, that baby is feeling that energy through you. Just like you talk to negative people, negativity rubs on you. You talk to someone positive, and even if you've got a negative mind, that person turns your whole perspective on how you were thinking. They change your whole perspective. You're going to say, oh no, I can't do this. It's not going to work out right. Talk to someone else. They say, no, there's a way going around it. Yeah. Go and do it. And then you say, oh, it was so easy. Being pregnant is not a sickness. Being pregnant is being happy. So that is what you need to give your baby. Talk good things. Like they say, your baby is listening to you from inception and conception. So if you are reading, if you're making dua, if you are talking properly, that child is going to learn that mannerism when it comes out. Maybe it'll even have a nice tune of cry when it comes out. It won't be howling and screeching. It'll have a nice tune. So that is what a mother needs to nurture from the day she knows I am pregnant.
First of all, I'm going to blame our government by allowing them to go to school. How can you allow a pregnant child to school? And it also it burdens the parent, because now when it's time for exams, the parent needs to be there. So for me, I just feel that government is just promoting something that is just a no-no.
It's always best to go through all the prenatal medical phases, and then all these pregnant women, we say glory to God, we thanks, and God should bless them more, but then they must also go through the whole primary health care. Yeah, that would be best.
Yeah. The problem with the pregnant women, they have just to look good from their own. That is all.
Check also what they are eating, to read. If they buy something, they need to read what is writing, the warning, all these things. You have to read it carefully, and they can protect the baby.
Don't eat for two. Keep your figure so that your husband can be still pleased. Okay, my wife, got this baby. She made me happy. Now she is trying to make my eyes happy also.
It would be biased for me to say, oh, they should eat this and that, you know what I mean? So I don't know what they're really going through.
So there we have it, your opinions on Pregnancy Awareness Week happening this week, and something that we must always talk about. I think, focus on what's happening inside, not just the mommy outside. So there's lots we need to discuss in Pregnancy Awareness Week. But in studio, we have specialists in studio, as I mentioned, a specialist obstetrician, gynecologist in private practice, Dr. Tahir Hassim, been around for the past 8 years and specialized in risk obstetrics. So shukran so much for your time and your expertise for this evening. Assalamu alaikum to you.
Walaikum salam.
And then from IMA, both Dr. Shaida and Dr. Hassim, we welcome Auntie Shaida for the first show of 2020. Welcome back, Auntie Shaida. How are you doing?
Alhamdulillah. Shukran dalilan for this opportunity. Assalamu alaikum wa rahmatullahi wa barakatuh. I think having just gone through the Quranic verses on pregnancy, pregnancy is truly a very special, beautiful and sacred time. And I think the Quran emphasizes on taking care of the pregnant mother, but that also emphasize on good eating, proper eating, not sitting and leading a sedentary life where people just sit back and think pregnancy is a time where you do nothing, that you're no longer active or you don't exercise or partake in activities that was previously, of course, meaningful and important. So I think that is something that we need to take cognizance of and take heed from the values of the Quran.
Absolutely. Shukran so much for that introduction, Dr. Shaida Omar. And back to you, Dr. Tahira. Looking at, Pregnancy Awareness Week, this highlight, why is it important? We've heard some of the people on the streets, their opinion on pregnant women and pregnancy itself. Please give us your specialized, of course, opinion.
I think, it's important for us not just to highlight pregnancy awareness just for this week. I think it's important for us to highlight it for every week and every day of the year, because we don't just fall pregnant for one period of time. Women are pregnant most of the time, and it just highlights the fact that we need to take care of ourselves and that there are facilities that are available, not just in public, in private as well. And there are different forms of facilities such as your midwife options, your public facilities where there are doctors and nurses, and your private care facilities. And it's important for women to know that there is early antenatal care, and that's quite important. And that helps us to help the women that they can have optimal antenatal care so that they can have a happy, healthy pregnancy. And we also invite their partners to become a bit more involved in the entire process, and we can educate them at the same time.
Absolutely. Dr. Shaida, looking at the partners and bringing them on board, how important is it, and what effect does it have on the family and the relationship between the two of them?
I agree with Dr. Tahira that it's a family thing, that the pregnancy did just not come about in isolation, and the way forward, because the initial response is, of course, elation, excitement, often excitement, but one needs to look at the future, the present and the future and the way forward, in terms of realistic expectations, looking at support structures, looking at management. So it's critical and essential that the partners be brought in, and if there are other children, that the children are also part of this process in making a realistic or understanding the reality. So there's a realistic appraisal of the way forward, what this will mean, how this will impact on their lives, on their personal times, on the leisure times, and of course this will assist in planning and addressing any challenges.
Absolutely. So highlighting the first 1,000 days, there's been this talk around that. What does that mean, the first 1,000 days?
So the first 1,000 days entails the period of time from conception to the first 2 years of life. That's the most important and critical period in the development of this little human, because that is the time where the fetus develops and there's neurological development. And it's important that this mother and the surrounding environment is at its optimal best, so that this baby develops well enough in terms of the neurological aspect as well as the physical aspect of this child. It's important for the mother to be well nourished and to take all her vitamins, and also have the emotional support, because that also helps this child to develop, and for that bonding and for the growth of this little child. That first 2 years of life is also quite important, because that's when the child develops and follows all the developmental milestones, and as well as their neurological development. So that's the first 1,000 days that we talk about.
Okay. Dr. Shaida, in your sort of industry, your media and coverage and marketing within the parents and the highlights on what's happening in the children, is enough being said about the first 1,000 days?
I think a lot more is being said now, a lot more awareness raising, within the antenatal facilities and healthcare, state healthcare facilities. But I don't think it's enough. That a lot more needs to be done, because often, as I mentioned earlier, that people have expectations, and often when their child is born, it's suddenly this creature, and it's a myth
taken
to
over
say,
my life.
it's a myth to accept and acknowledge that I'm going to love this creature from the time it's born, or that I've bonded with it since since I've conceived it, because when the reality comes through, it can be quite harsh, daunting, and painful, because one is not prepared for the sleepless nights, for the colicky baby, for everything else that goes with it. Suddenly you feel you're totally out of control.
Sure. Very true, and like I said, it literally takes over your life. So from your side, Dr. Tahira, medically, what are you as gynecologists and professionals, within the industry, trying to highlight to pregnant moms as, what is important to do at this time when you're pregnant?
For the first 1,000 days. So ideally, prior to conception, we're trying to encourage the administration of folic acid, which is quite important for the brain and spine development. But a lot of the times our patients come to us and they've already conceived. So as soon as we see them, we start them on the folic acid, which does help with the brain and spine development. And then we look at trying to put them onto iron supplements as well.
Okay.
Some of them are quite nauseous and they can't handle the iron, so we try and supplement them with their diets, but that's all not enough. But when they are able to tolerate, we do encourage iron supplementation right until the end, because it was found in certain studies that women that had iron deficiency in pregnancy, their children had neurodevelopmental delays.
Okay.
So if the moms are iron deficient, we'd love to supplement them, because later in life we do find that these little kids did have neurodevelopmental delays. And then obviously your other vitamins, which we are going to talk about a bit later in the show, we encourage that as well.
Okay.
I just want to add to what Dr. Tahira said. The lack of the vitamins, but I think also risky lifestyles that could contribute to neurodevelopmental challenges, which needs to be factored. But I think that needs to be well before the pregnancy, in terms of conscientizing potential would-be mothers out there.
Is it quite an issue, the nutrition of moms, the hydration levels, what they are lacking because of, this extraction of this baby, and all, what this baby is taking from mom? How important is, taking care of yourself in that instance?
It's
as a pregnant mom?
Extremely important, because I have seen quite recently that we're seeing quite a bit of women that are living in, good homes with, sort of middle class to up class incomes, but they're having babies that are super small and growth restricted, and that's because they don't really take good care of themselves nutritionally, and they don't hydrate themselves well enough, as well as the stress that's around them.
Wow.
So we are seeing smaller babies with growth issues, although they come from, good homes.
Yeah, and not sort of the factor of, having the issue of not, having enough food or water or any of that.
But again,
so what's happening there, Dr. Shana?
Yeah, and I think we had this discussion before we started the program. I think social media has a huge role to play, because of pressure of physical appearance as well. Mothers to be are often afraid to gain weight, and of course the way they consume food is not always healthy or in the best interest of the baby. So I think that is also something that one needs to factor, because they understand or misunderstand that if they're going to eat sufficiently or they eat less, certainly they will not gain weight, and they're more concerned about the weight gain than actually the health of the baby.
And then you get the other group where they eat for 2 or eat for 3, and then they have
Is it just
all
because
the,
they are like that, or they understand it too?
No, that's like the other group that have, like, you know, the cultural side of things.
Then I have to eat more because I'm pregnant.
Yeah, because you're pregnant and you don't exercise because you're not supposed to do anything when you're pregnant. So there's all these different myths that come into play.
Extremes.
There's two extremes.
There's polarities here. We're talking of extremes.
And then you end up having the patient that's overweight with all sorts of medical problems, and then you have the underweight patient with a baby that's super small.
Okay. What is happening to the babies that we need to understand if we are not giving our bodies, which is now going to be transferred to the babies, what it needs? What is happening in either, example?
So you get you either get a growth restricted baby that ends up coming out early. So we end up having to do an early cesarean section, and there's placental insufficiency. And then those babies end up going to ICU. Then we predispose them to ICU settings where they can pick up germs from the ICU, and they end up picking up all sorts of infections, and they have delayed stays in ICU. And those are the ones that end up with developmental issues because of that. And sometimes you end up delivering them early, and because of a preterm delivery, they may have other issues.
Yeah, so being exposed to some things of this world now that they're not meant to.
Yeah, and then you have your baby that arrives from the mom who's got the diabetes in pregnancy, which you could have avoided. And they have all sorts of other problems where they could become diabetic as children or as adults later in life. So they have all sorts of issues as well.
Yeah.
But I just want to share, I think we also see mothers that are consumed with their appearance. They go to gym, but they engage in such vigorous exercise that is not in the best interest of that baby. Because of their fear of weight gain, they put themselves under
Is that true?
Threat and risk.
Is that true? Going to in an excessive manner, exercising in a way that is actually going to make you lose weight while you're pregnant.
There is that group of extremes. And when you do exercise to that extreme, if you can't breathe and you can't speak while you're exercising and have a full sentence when you're exercising.
That's too much.
Yes.
You need to know. Okay.
Right. Especially while you're pregnant.
Yes.
Yeah.
I just, before we have to take a break, and when we come back, I just want to understand this whole idea. Why is it that we don't, take this moment of pregnancy, this journey, as the miracle that it is? We talk more on Pregnancy Awareness Week, which is highlighted on our health calendar, more also on HPV vaccine. But we want your interaction. Tell us what you think just after this. Assalamu alaikum and welcome back. This is Health Matters, and remember you can catch any of our missed shows on our YouTube channel and also interact during this live show via WhatsApp and our live telephone number. In studio, we're highlighting Pregnancy Awareness Week with specialist obstetrician Dr. Tahira Hasim and our in-house medical specialist, Dr. Shaida Umar. So just one or two things I want to touch on with regards to Pregnancy Awareness Week, and coming back to, knowing when to call your doctor. When do you call your specialist? I know we are freaky when it comes to pregnancy, so we don't know when and when not to. So just guide us.
Okay, so the most important is if you start bleeding.
Okay.
And look, spotting can be quite normal in pregnancy, but if you're unsure, rather call your doctor or come in to the hospital. The second thing would be if you have a headache with blurred vision. Headaches are quite common in pregnancy, but if there's headaches with blurred vision, you need to call your doctor immediately or get to the casualty. The other thing is pain associated with bleeding is classified as an emergency. After 28 weeks, if you're not feeling your baby's movements to be quite regular, we normally say 10 movements in an hour or 10 movements in 12 hours, then call your doctor or get to the hospital. Okay. Usually, when you're worried about movements, have something to eat or have something sweet. If the baby still doesn't respond, then, get help.
What is the hour period? 24 hours that you're not feeling
an hour.
baby? 1 hour.
So once you've eaten,
Okay.
and if the baby hasn't responded to that, then you need to get going. But usually after 28 weeks.
Okay.
Before 28 weeks, the babies don't usually have a pattern, so they move randomly. So you can't really track the movements, and they're not viable before 28 weeks. Okay. The other important things are like if your legs start swelling and you're worried about high blood pressure. So contact your doctor. If you can't get a hold of your doctor, then you can go to your local clinic or your GP and do a blood pressure. And if the blood pressure is okay, swelling can be quite normal. But if the blood pressure is up, then we worry about that. The other important thing is if your urine has changed color. And if it's become quite dark, then we worry about things like preeclampsia or high blood pressure in pregnancy. That needs to be attended to, or contact your doctor, as I said. And other things like if you think you're contracting, if you're in labor.
Braxton Hicks, difference, knowing the difference.
Yeah, Braxton Hicks is more like discomfort.
Okay.
With contractions, you can time it, so it's quite regular.
Okay.
So there's a difference. But if you're unsure, call.
False alarms, emergency false alarms.
Dr. Tahira spoke about high blood pressure. When people have severe low blood pressure and they just feel they cannot even lift themselves or they cannot move.
Yeah, is that an issue?
Would that be something of concern that needs to be addressed?
Look, low blood pressure is quite common in pregnancy, but if you at that point where your blood pressure is extremely low, sometimes we do admit our patients and give them volume expanders to lift them. The other thing that we do encourage is a bit of salt. But, when we have such extreme low blood pressures, we like to investigate our patients and do some blood work, admit them for a bit and just see what their pressures are like over 24 hours. Because when we have these big jumps with the blood pressures going up and down, it does have placental issues. And we do want to monitor those patients because they can have growth issues with the babies. So those are patients that are sort of worrying.
Okay.
So we would
keep an eye on
we would keep an eye on them.
And chronic bouts of vomiting and diarrhea, would that concern be of a matter of concern as well?
Yes, that would be a concern. Usually
because there's gastric going around now.
There is gastric flu going around at the moment.
From Cape Town to Joburg,
And I find people self-medicate, so maybe that's something that you can just speak to.
And the idea of safe, what is safe for pregnant moms to use as well?
You can't look. There's certain medications that are safe. We're not allowed to use their trade names on the show.
Course, yeah.
But I think it's best to rather discuss it with your doctor because not every medication is applicable to every patient. It would depend on their medical conditions because there's certain things that are contraindicated. So I'd prefer that they call and check with their practitioners.
So lastly, I just want to check with Dr. Shaider with regards to, pregnant women's rights. Often you find that within the workplace they get discriminated, within, even being in the public sector, there could be an issue as something that, not serious enough of identifying to that mom. So let's just talk about, knowing your rights when you are pregnant.
Okay, so I think more specifically now with gender-based violence being on the forefront within the political arena and within the landscape of South Africa, a lot of focus and attention is placed on women's rights. And of course, definitely a pregnant woman cannot be discriminated when she's seeking employment. She has every equal and equitable opportunity and right in, if she's applied for a position, she cannot be discriminated. And if there is any form of discrimination, she would be in her full rights to take that up further in terms of, labor law and other legal avenues. So, and even in terms of sick leave, she's entitled to, besides the maternity benefits, that should she feel ill, she would be allowed according to the sick leave schedule, which is 36 days over a 3-year period. So it's more, I think the attention and the entitlement of rights are granted and a woman is allowed that space.
We need to know it and then
in terms of the paternity or paternal benefits as well, we know that now it's been extended to 10 days for the father.
So anything you want to add to that, Dr. Tahira?
No, I think you've covered it quite nicely.
We want to look at now the HPV vaccine, and before we do that, we go to the streets and chat to some of our viewers to find out if they really know what it's all about. Take a listen.
I think I would promote it because it's for a good cause. You making sure that your child is safe. You understand? Because I mean, cancer is a thing that we all dealing. It's in our families and it's around us. You know, we have friends, families that are going through it, and I think if we are aware of it, we will accept it.
I haven't heard about it, but as I say, the first thing is teach your children sex education. Girls as young, as soon as they reach the puberty, they are pregnant. And then what happens? They're not even trained to be children. They're not even adults, but they are pregnant. Okay? I don't say you can teach them this in school. It needs to be started at home. The best education comes from a mother and a father, whether it's a boy child or a girl child. There's nothing wrong with sex. I mean, it's a natural thing. We all go through it at some time or the other. So it teaches us to be women, to respect our bodies. And then if you don't have sex from the age of 11, you don't need to be even immunized because you know already how to look after your body. You're looking after your body. You're not indulging in the wrong things. You wait. I mean, in Islam, it teaches you a man cannot touch you until you are married. So that already, if you're going to do a consensus of, I'm not being in any way picking on anyone, if you do a consensus of how many Muslims got HIV.
Cancer doesn't have an age.
Yes.
So it depends, like how old, or maybe it's running from the family.
Yes.
Then you'll never know. So sooner the earlier the child gets checked, then it's much better to maintain it.
I used to have actually a friend who actually had cancer at a young age, and I wish I could have known then to advise her. But then, hey, you know, because it was back then, and the thing is, I didn't know that actually food has a lot to contribute.
Yes.
So
I think it should be compulsory as a primary health care. Yeah, I think our minister should endorse it as a primary health care that should be implemented to all our kids, actually, because the earlier the better.
There we have it. Your opinions on the streets as we ask the question, do you know what HPV vaccine is all about? So let's start with you, Dr. Tahira. Tell us what exactly is this HPV vaccine?
Okay, firstly, HPV is
human. The way
human
I mumbled it earlier.
Virus, okay?
Human papilloma virus.
Yeah, so I first want to go through what it is.
Okay.
So the human papilloma virus is a virus that gets transmitted through the skin by skin contact, and it's also a virus that is sexually transmitted. And it's one of the viruses that is responsible for 6 cancers, which is genital cancers, which is associated with cervical, vulval, and vaginal cancers, as well as throat cancers, penile cancers, and anal cancers. Okay. So the vaccine is to prevent certain types of the human papilloma virus. There's over 100 types of these kind of viruses, but 40 of them are responsible for cancers. So the vaccine that's available at the moment covers 9 of the viruses, of the subtypes of the viruses. Okay. Previously, it used to only cover 4 of the subtypes, which covered 16 and 18, which was responsible for cancer, and the other 2, 6 and 11, which was responsible for warts. So the vaccine is purely just to prevent the transmission of those particular viruses.
Okay, so make us understand if it's prevalent in women mostly, and is that the case? And how can this HPV be treated?
HPV is not just prevalent in women.
Okay.
It's prevalent in the population, in about 80% of the population. And it's because it's transmitted via skin contact, we can't treat it. Once it's in the system, it's in the system.
Okay.
Sometimes it lies dormant and sometimes it disappears. So the reason behind the vaccine is purely to help reduce the chances of cancer. And because 16 and 18 is the most common subtype that causes cancer, we use the vaccine to prevent cervical cancer and penile cancers.
Okay, let's talk about the rollout of this vaccine in schools, Dr. Shaida. The understanding of it. Do parents, do children actually understand, or young girls rather, I think it's from grade 4 that they are introduced or, can get this vaccine. What do we need to ask? What do we need to know about this? Because there might be some objection around it.
So I think that earlier on the opinions from your people that responded, that comprehensive sexual education is critical, it's essential, that not only our children but our parents and our broader communities out there are empowered, enabled and equipped to understand the risks that are lurking around everywhere. So previously the HPV vaccine was received with a lot of resistance, and parents were not keen to allow their children to be vaccinated. Yes. With the awareness raising, more conscientizing and understanding the implications of not receiving the vaccine, there's been a lot more buy-in, and there's been proper protocols that have been followed through where parents have to sign consent forms, there's briefing sessions, there's workshops, so children also understand why they're actually undergoing this process.
Okay, so let's look at the age that they're going to get it, how it's administered. Just after the short break, please interact with us if you have any questions on this HPV vaccine and more just after this. Stay with us. Assalamu alaikum and welcome back. In our last few minutes, we wrap up the HPV vaccine, human papillomas virus, and it's got nothing to do with herpes. Let's chat to our panel in studio, Dr. Tahira and Dr. Shaida Omar. HPV, we found out exactly what it is. I was amazed at the sort of cancers it can actually prevent, because my understanding was just cervical. So with shows like this and information, sex education, information to our children, and that's also sort of another contentious topic with regards to highlighting it. Grade 4, the kids are 10 years old, talking to little ones about sex, Auntie Shaida. We're going to talk about that in a bit. But quickly on the vaccine, how is it administered?
So there's different regimes. With the younger kids, we only do 2 intramuscular shots, and they are 6 months apart. And older kids that are above 15, there's different guidelines. They can get 3 administrations. So one is given now, then 2 months later, and then 6 months after that. And then in your immunocompromised people, then we do 3 shots. So it just depends. So it depends on the profile. But your grade 4 learners, we do just 2 shots, and it's just an injection.
Okay, and then they get again at 6 months,
At
6 months later, still within grade 4.
Yeah.
And the protocol, Auntie Shaida, to your knowledge, what needs to be followed from the school or the clinic when the grade 4 young girl is getting this?
Well, as I said, I think previously there was a lot of resistance around that. But now it's legislated where it's actually compulsory, but there's briefing sessions before that. There's consent forms that have to be completed where parents have to sign that. And I think it's important to understand and appreciate that there are a lot of myths and misconceptions around the HPV virus, where people believe that their child won't be able to conceive, or there'll be other serious consequences or side effects of it. So there's health education where medical professionals are also brought in and to brief parents and children beforehand, so that they understand the importance of minimizing the risks around the potential development of any cancer in the future.
Okay, so let's talk about that myths and misconceptions around this HPV vaccine. So parents wanting to know, will my child get sick when they have this vaccine? What is in the vaccine? Will my daughter still be able to fall pregnant one day?
So the side effects from the vaccine are short-term. Obviously, they'll have a bit of pain from the injection. Sometimes there's reddening or bruising from the injection. And if they have a yeast allergy, then they shouldn't be given the vaccine.
A yeast allergy?
Yeah.
Okay.
Because the actual vaccine has yeast in it. Okay. And the vaccine contains proteins that are similar to the HPV virus, and that's why it's used as a vaccine. And then your other question was whether
the child, my daughter, will be able to fall pregnant one day.
There's no issue with pregnancy, but obviously if they don't receive the vaccine and they are infected with HPV and they do end up having cervical changes where they have to have biopsies of the cervix and treatment for that because of the changes of the cells on the cervix, then that can compromise fertility.
Okay.
But the vaccine itself does not.
And another question from a viewer was, will one still need cervical screening, a pap smear when you're older,
yes,
after this?
Definitely.
So still follow normal protocol.
To have your pap smears.
Screenings and stuff at your gynecologist. Okay, we need to wrap up. Dr. Shaida, your last words on Pregnancy Awareness Week and this actual rollout of the HPV vaccine.
Well, I think pregnancy awareness, my one response is always consult with your doctor, consult with your specialist. And then as far as HPV, it's important that parents communicate with their children, that they start engaging in dialogue around sex and sexuality. It's not teaching your child to have sex, but minimizing risk factors.
Absolutely. And your last words from our specialist obstetrician with regards to pregnancy and HPV.
I think it would be around HPV. I think if there's one investment that you can make, go for the HPV vaccine. Send your kids for the HPV vaccine.
Is it just available at the schools, or can you actually visit your local clinic?
You can get it
in the private sector.
You can get it in the private sector. You can get a script from your GP and have it done at like your local pharmacies as well.
Okay, great.
Yeah.
Shukran so much for your time, Dr. Tahira Hassim, and of course, Dr. Shaida Omar. Hope to see you guys soon. Have a safe travel home, inshallah. And remember, any of your questions, please visit your local website and, use safe websites, and especially the government websites, our health department. Ask your questions, go to your specialist, and inshallah, they will guide you in that right direction. Let us keep talking about the concerns that's within our community. From myself, Khawa Salman wa assalamu alaikum. And remember, next week, we ask you, what are you eating? Do you know what is in your food that you're eating? More on that next week. Wassalamu alaikum and goodbye for now.